Hi, ladies. So, hoping we're going to be able to bring the lovely Melanie Cunningham on to chat with me. Seems to be playing games today. He's trying to join her on. So, Melanie is an NHS nurse and a mindful practitioner. So, this is going to be an interesting chat tonight. He's trying to say she's joining. And there she is. Hi, Melanie.
Hello.
How are you?
I'm good.
Oh, it's on a slow today. Can you hear me all right?
I can, yeah. I can't see you, but I can hear you.
Oh, you can't see me? Where
I did see you, and then you've disappeared. I can only see myself, which is very...
I can see you, but you can't see me. You can just hear me. So
That's fine.
bit strange, but yeah. Well, welcome. Thank you very much for coming on tonight. So I think this is going to be an interesting chat for the ladies to sort of listen back to. So did you just want to explain very quickly who you are?
Yep. So I'm everybody calls me Mel, so it's Mel Cunningham, and I've been a nurse for over 30 years now. I'm mainly a nurse practitioner in a surgery, and I do out of hours. And probably about 8 years ago, I trained to be a mindfulness teacher as well, just to help. I did it myself to help with stress levels and anxiety, and I enjoyed it so much and thought that it's probably something that I could do myself and incorporate it into my work. So I do mindfulness, and before COVID I was running regular mindfulness courses. So it's an 8-week course that people can join, and then we go through the whole mindfulness techniques, and you come out sort of an expert in mindfulness at the end of it. And it's very helpful for menopause, or for lots of things.
Yeah, I think joined with sort of your knowledge as well, with what you know from the NHS, it's quite a good thing to have together. So you've got your medicine knowledge, and then being able to incorporate mindfulness is an amazing thing to be able to do and to offer people, I think. So especially, like I say, since COVID, not just for menopausal women, I think women, men, whoever, people are sort of struggling a little bit. So mindfulness is a fantastic thing to be able to offer. So yeah, it's quite exciting. So we're just going to chat a little bit about symptoms and sort of the GP kind of route, but then we're going to go into sort of talking a little bit more about mindfulness and how that can run alongside things. So just from your knowledge working at the surgery, what are the most common symptoms you think and challenges that women tend to come to the GPs for?
So I suppose the most popular seems to be fatigue. You get a lot of women that really struggle with the fatigue side of it, and I think that starts sort of in early perimenopause, doesn't it? So it can start. So perimenopause can start any sort of roughly up to 10 years before your menopause. So you see a lot of women, maybe in their late 30s, early 40s, start to get the fatigue first, and then they start to worry why they're getting very, very tired. And then hot flushes. Funny enough, hot flushes isn't the biggest symptom. Fatigue, mood changes, and the period irregularities. So, women having very heavy, prolonged bleeding, and then maybe skipping months, and again that causes quite a lot of concern, and often a lot of women don't think about that it is the perimenopause. They just think something's not right with themselves, and so we get a lot of that coming in. So yeah, and then there's the mood changes, and people feel quite low, don't they, or they can feel quite angry. So it's quite difficult and quite a challenge, because in GP land we're not specifically trained in the menopause. I'm quite lucky in a way, because I've done it for over 20 years in GP land, and I was a practice nurse to start off with, and then I did a lot of women care, a lot of contraception, lots of smears, and over time you meet you meet lots of women that are going through the change, and now I've gone through the change myself.
Mm,
So I'm very, very sympathetic. We have a few female GPs at our surgery that are very interested in it,
mm,
and one in particular that's very, very good. And over the last year, we've done lots of training and trying to eke out to the rest of the colleagues about helping with the menopause. Um, but it's quite difficult because it's e-consult, and a lot of people, it's quite impersonal,
mm,
isn't it? And
yeah,
try to ring people back. But we're getting there. So my main thing to people is just to hang in there with us. It's not that we're not dismissing people. It's a lot of the times some clinicians just don't know what to do.
yeah,
Basically,
yeah. Well,
it's not very good. But
there's so many different things that the GPs deal with, isn't
there
there? So, and this is
there
quite a
is.
specialist sort of area, and a lot of the symptoms can be, you know, related to other things as well. So it's quite a difficult, like you say, unless you've actually got time with people, it can be quite difficult to sort of get to the bottom of what it is. I mean, how can women sort of advocate for themselves when they're seeking the help of sort of medical help from the GPs?
I mean, I think starting a symptom diary seems quite simple, doesn't it? But little things like that, just to write down what, so that you're not forgetting, because that's the other thing, isn't it? Our brain fog, and you forget things. And sometimes it's hard to find a pattern until you start writing things down, what happens each month. So I think symptom diary are very good. And they're quite helpful because then, especially when you do e-consults, you can write quite a lot in, or you can attach it as a, as a attachment at the end of it. So that's quite helpful. I think also maybe doing a little bit of your own research, looking up, there's quite a lot of good websites now. Menopause Matters, Rock My Menopause, and Davina McCall's got lots of information out there. There's quite a few other people. So there is lots of information out there, and often if you do a little bit of your own research, that's quite helpful. Um, and even just the NHS sites, that their menopause one's really good, especially about HRT and other things if you can't take HRT. Um, and I think the other thing is to look at your lifestyle and start to look at what you can do to help yourself as well, because we do go on a lot about lifestyle, because it is massive in the menopause, and also because the menopause is a change, and then you're in it, and then that's it for your life. And so you do need to make those changes to help improve your health going forward. There's a lot of things about the cardiac and dementia, and with the lack of hormones, if we don't change our diet, or we don't look at exercise, or we don't reduce our weight, we put ourselves, our risk factors go up, quite significantly and quite quickly, which is quite, I don't think that's discussed a lot about, is it, about your cholesterol levels, and how your cholesterol levels can suddenly go from quite normal to very high within a year, because estrogen actually is a protective for your cardiac, and is really good for your cholesterol. So those things aren't discussed. So I think, it's quite good to make sure you get an MOT with your GP, make sure you get your cholesterol checks, you get your glucose checked, your weight, your blood pressure. All those things are quite important as well, so that you can do an overall of health, rather than just focusing on the menopause and other things.
Yeah. I mean, what treatments are available for women? Because we obviously know there's HRT, but there's so many different options, isn't there?
There is. So for hot flushes, some of the SSRIs, which are traditionally for anxiety, so things like paroxetine or fluoxetine, um, they're quite helpful, and they can help with mood as well. So if you're quite depressed, and it's certainly lots of evidence to say that they can help with hot flushes. Clonidine is another one. It's not I mean, we're not too keen to, because it's got quite a lot of side effects. But I mean, looking up recently, there is new things coming out all the time,
Yeah.
and especially for women that have endometriosis. And but then even with HRT now, because it's newer and it's different, and it's very it's much more like our normal hormones. there is even more evidence to come out that actually women with endometriosis maybe can use it, as long as you've got that progesterone cover. So there is lots of new things coming out as we're speaking. So
yeah, that was actually a GP friend of mine actually said to me, because being somebody that has endometriosis, I know that Jane that's come on has got endometriosis, I always get it confused. So we've both been told that we can't use it, but then a GP did say to me it depends on where the endometriosis is, so that it really is, you know, worth speaking to someone rather than just completely ruling out and saying, oh, I've been told I can't have it. It's worth, you know, having that e-consult and chatting to a GP thoroughly about it, isn't it?
yeah, absolutely, because there is, and it's worth. There is different treatments, and I know people say, "Oh, you know, you're fobbing me off because you're just saying to have like antidepressants," and I'm not depressed. But there's lots of evidence to say that some of these on lower doses do help, so it is worth it. And also, we forget when we go through the menopause, we have lots of other issues that go on, don't we? Our children are growing up, our parents are becoming elderly, we have lots of stresses, and there's other things going on. So there may be a combination. Maybe we are a little bit depressed on top of the menopause, and then that estrogen, the lack of it. And it's not just the lack of estrogen, it's the lower testosterone and progesterone, which are, you know, we forget, we just talk about estrogen, but actually it's the whole combination, isn't it? So it's very important to
I suppose it's the lack of sleep and things, isn't it, as well? And, you know, quite often we talk about hot flushes keeping you up, but actually there is that, I know we've spoken about it, the whole witching hour, where you wake up and think, oh my God, I'm wide awake, and you're trying to get yourself back to sleep. And, you know, night after night over a long period of time, that's going to affect your mental health, isn't it? So,
yeah,
as well as your health in general, because if you're not sleeping, you're not repairing. So I know this is a subject that I've already spoken to some other ladies about on these live talks, but you know, lack of sleep, it has a massive impact. And I think that's where, you know, we kind of look for the medical treatments, but actually there's so many other things we can be doing as well. And like you mentioned about your kind of your lifestyle and what we're eating, the diet and things, but obviously things like mindfulness are not something that are particularly highlighted, I don't think, in the press to do with
no,
menopause. But obviously, as you know, as a practitioner, running alongside the medication, it can massively help, can't it?
yeah. Oh, definitely, because it's also our mindset about the menopause, isn't it? I know myself, when I was starting to go through it, at the beginning I was like, oh, this is fine, I'm all right, I'm doing okay. And then since I've gone into the menopause and I've not had a period for over a year, and I don't have the anxiety as much or the depression, I just feel really angry. Really angry. And I cannot, I just go from 0 to 100, and it's like, and it's really quite shocking, all the other bits that come, isn't it? And you just think, oh my God, where's that come from? And I think we forget that, you know, techniques that help us to control how we feel. And it's also, it's a big change, it's a huge life change. We're getting older, you know, we look older, we feel older, and I think that's quite, it's almost like you're saying goodbye to a life, aren't you? And it's like a new life that we're starting, and different things coming into it. And I think sometimes getting your head around that mindset and actually seeing this as, you know, lots of exciting things that could come. We've got, you know, a new life ahead of us, and we live longer, and it's about trying to make our life and feel better in ourselves, that we can actually really enjoy that life ahead of us.
Yeah.
So I think that's where I found mindfulness has really helped me to
Yeah.
like use the values of mindfulness to accept and be patient with myself. And one of the, because the mindfulness has 7 values that you run along. So they have, so it's acceptance, letting go, patience, beginner's mind, non-striving, and trust, and non-judgmental. Those are the values that we have, and they all they overlap a lot, and it's quite good because it is about accepting that we're in the menopause, and accepting that maybe we need to have to change the way we think about ourselves and how we adjust, isn't it? Like you were saying about exercising in one of your blogs that you put on, about how sometimes we can't do what we used to do, you know, because running and things like that. I used to run a lot, but I find that that puts my cortisol levels up, and I was putting on loads of weight even though I was exercising really a lot like I was before. But it's because my stress levels were going up, and then I was, you know, putting lots of weight around my middle. So I've adjusted, and it's really helped. So I think it's just those different things, isn't it, that we have to do to accept and just tweak what we're doing.
Yeah, and it is, like you say, it's that acceptance. I mean, I was reading a book a little while ago, and I know in some of the Eastern countries they call it the new spring, and I love that, because it is, and it, you know, it is a massive transition, isn't it? We go through that transition when we become mothers, and that's quite a shock to the system. But then we got this other transition, and you know, most of us are at that end where we can't wait to not have periods anymore. But it is that kind of dawning on you that, wow, you feel old, like you say, even though you probably don't look like you've aged a lot in the past few years, but you feel it, because it's kind of, you're aching, your body aches, you know, like you say, you can't exercise like you did. So it's kind of that, like you say, an acceptance. And that's where mindfulness really, really helps to kind of get you through. Because once you've gone through that transition, you start to accept your new life as such, isn't it? It's that new beginning. That's a nice way to think about it. But obviously, when you're transitioning through it, doesn't feel like it.
No. And you feel like it's an end. You know, if you can't have children, and you know, I mean, years and years ago, women died not long after the menopause, wasn't it? Because it was almost like the end of their life, wasn't it?
Yeah.
But now we live into our 90s and some even into our hundreds. And, you know, so we're only kind of halfway. But then that can feel daunting, because you think, oh my God, I mean, already I feel like I'm like 90 when I get out of bed, especially if I've exercised the day before. Think, oh God, what's it going to be like in 20 years' time? But but I think we forget that also a lot of women, if you hear when they've gone through the menopause, I think our bodies adjust, and then the inflammation levels, then we're through that shock. And I think once our body settles and accepts, and then whatever treatments we have maybe that will help us, or just changing our lifestyle, I do think that then improves. And then, you know, it's just the sort of shock, isn't it? It's like when we first started our periods, it was horrific, wasn't it? And the pain and everything, but then you just get used to it all, don't you?
You do, and you kind of go through it for such a long time that you kind of do get used to it, even if, you know, you've got issues like endometriosis, or, you know, things that go on like cysts and things. It is something in your body that you just deal with. So, you know, it's the same with menopause, isn't it? It's kind of that, the shock that it's sort of happening now, and oh my God, how did that happen already? How am I even at that
I know.
stage? That menopause is a shock. But we're always thinking about kind of the medications, all the different supplements, how we're supposed to live. But you know, mindfulness is free. You know, if you're learning those techniques, and they can help with sort of different things like hot flushes, fatigue, sleep issues. They can actually help with that kind of thing as well, can't they?
Oh, definitely, definitely. Because I think, you know, with mindfulness, you have the two versions. So you have the meditation side of it, which helps you to relax. And we know, like from your classes at the end, when you know you have those lovely meditations that you can do, or even through the yoga, you do all the little breathing bits, and you know, you get into a position, you think, oh my God, I'm never going to be able to hold this, and then you do a bit of breathing and it relaxes you, and then you just feel so much better. And so the formal, you know, meditation part of mindfulness is really good. And if you practiced it regularly, you would definitely, there's so much research out there to say that really, really helps with lots of things. But the informal bit of mindfulness is always a little bit of the harder bit, which when people come on the courses find it quite hard, because this is the bit where we have to live in the here and now. So it's using your values, and it's using the meditation techniques to then learn. You know, we go and have a shower, we're not thinking about how wonderful the shower is and how nice it feels, that hot water. We're writing lists of what we need to do at Sainsbury's, where we're going to be going, what we're having for tea, what somebody said last night to us. That husband was snoring all night, I haven't slept well. And before you get out the shower, you're as stressed as anything. And then our cortisol levels are already sky high in the morning, and even worse so during the menopause, because we haven't got the lovely estrogen to bring it down. So then it just, we just go on and on all throughout the day, don't we? And what mindfulness does is it brings us back to the right. I'm having my shower and I'm just going to enjoy the here and now, and just thinking, just as you go throughout the day, of thinking about the here and now. And it's quite a hard technique to do, but again, it's very good for just the whole of the menopause, isn't it? We've if you really thought about what happens to our bodies and what's going to be happening to it, you just go into complete panic. But we don't know. We've just got to do today, and focus on what we can do to help ourselves, to hope that we just keep doing that day to day.
It is like you say, like being in tune with that moment, because we are rushing, we are doing too much. We're doing more than women have ever done, and it's our fault because we wanted too much. But the thing is, and that women are working a lot harder than they did before. Sort of our mums, but grandmothers, they wouldn't have been working like we are now. And like you say, we're then trying to look after parents as well as children, and you've got the stress of work and just too much going on. So then you don't get that time to unwind and relax, which is hugely important, like you say, to bring those cortisol levels down. But when you're getting those moments where you, like you're saying, having that shower, even a bubble bath, or just, enjoying a cup of tea for what it is and standing out in fresh air, you're thinking about all those things that we need to do. And I think our bodies are in that fight and flight all the time. So that mindfulness is kind of like learning to live in the moment a little bit, and bringing that yourself back down to be able to bring that cortisol levels down, really, isn't it? I think a lot of people are not quite sure what mindfulness is, though, are they? So
No, I think they
meditation.
sort of, when it first came out, everybody was like, it empties your mind, it's sort of, I think that's what a lot of people sort of thought it is. And just the simple thing of it just focuses on here and now. And I think because we're always in the past, or we're always in the future. That's, we're always worrying about what happened yesterday. We're overthinking, we over worry about whatever, and then we're always worrying about what's coming, and we just forget the simple things each day. And I think our lives are flashing ahead of us, aren't they? And we just forget to just enjoy, like you say, the little simple things. And sometimes just putting that back into your life, especially at this stage in our lives, where we can just do so many different things, new hobbies, and we've got lots of things that we can still learn and be interested in, and enjoy, and make sure that every day you're doing something for yourself, not for just everybody all the time, especially as time goes on and we do have all our extra stresses in our lives.
And I think that's the thing, is women, we're used to doing everything, running the home. We're always the sort of ones that pretty much look after the children, but then we're trying to get back to work, and that's that whole thing again. And it's kind of always looking after everybody else. And this is a time where it's really important to look after yourself as well, having that self-care. And I think people think it's selfish to talk about self-care, but it's actually really important for your physical and your mental well-being
So,
as well. Learning to
absolutely.
help to balance those hormones a bit more. These natural things will probably help balance hormones far more than medication, or because you can have all the medications in the world. If you're living a stressful life and you're not giving yourself that time for self-care, then you're still going to have issues. It's still going to be there, isn't it? It's kind of
Well, totally, because that's the thing about like HRT, you know, if you can have it and it works, and that's all great, but it's only one very small part of it. It's like putting a plaster on a wound. It's only going to do so much. The rest of the healing and the rest of everything else has got to be everything else that's around it, because you know, probably can, if you were having HRT, does not necessarily going to have to be able to have it for the rest of your life, and you've got to do all the other bits, haven't you? So it's why in the guidelines for menopause, the first line treatment is lifestyle. It's, you know, in changing and doing things like CBT or mindfulness, or you know, all the supplementary in your exercise and your diet. It's so important.
I suppose with the mindfulness, it helps you to kind of tune into your own body. So, you know, something that can really help you with kind of being aware of yourself, not just about slowing down and being aware of what's around you. It's sort of being tuned into your own body as well, I guess, as well.
Absolutely, because we forget, don't we? And so things like a body scan, it's the most amazing meditation you can do every day, because it just checks in every day. You just, you know, thinking about where your body is and what you're doing. And it's when you wake up and, you know, maybe everything seems overwhelming or whatever, you just do a little quick body scan, kind of check in and in tune with everything and relax. You know, it really does make a difference. And also with pain, they say a lot, you know, if you focus in on a body scan and kind of go round, if you've got a pain in a certain area, but you maybe go round the outer part of it all and not focus on that to start off with, it lessens the pain that you've got. I mean, it works in things like they're doing them for scans and loads of things now to just help relax people so that they're able to feel better, and then they don't need even relaxants to go into a lot of these things, because it's a bit like sort of hypnosis, isn't it? Self-hypnosis.
Yeah.
It does do an amazing.
Mind over body.
It is. It is. And when our body's constantly in fight or flight, which most of the time it is, you know, we get pains all over, don't we? We can have headaches, stomach pains, irritable bowel gets worse. There's just, you know, our whole being is affected just by our cortisol levels, basically. And so by just reducing them down in any way that we can makes such a difference. Really does.
Quite surprising and quite scary, really, how much having that spiked cortisol really affects your body as well, isn't it? Because it really does. Like you say, it's not just one thing. You can have headaches, you can have aches and pains that, you know, irritate your bowels. It's kind of like, you know, it's kind of very important that we try to do things to help try and balance those cortisol levels as much as we can.
Yeah.
So,
Oh, absolutely. Because it's also the inflammation that, you know, it's causing in our bodies, and then that inflammation then leads to all different types. And that's why a lot of women, you know, the conditions like ME, fibromyalgia, you know, IBS, and lots of other, you know, rheumatoid arthritis. That's lots and lots of women have it, and it's because of the higher cortisol levels that they have, and that is often triggered through the sort of menopause. So you find a lot of women end up with inflammatory conditions, you know, during or after the menopause because of that. So it is so important that we try and get that inflammation level down. But they don't talk about those things at all, do they?
they don't at all. It is, you just hear the basic. I mean, obviously there's, was it 32, 33 roughly different symptoms, probably more, but the ones you sort of know about, hot flushes, not sleeping, some very basic ones. You know, I didn't even know initially until, you know, I was going through it and Davina McCall made it, you know, a bit more out there with people, that things like anxiety were a thing. You know, it's kind of like the depression and those kind of things were actually connected, but yet these are things that have very clearly gone on for years and years and years. And it's probably just heightened by our lifestyles now, but it's always been there, hasn't it? You know, and they used to lock women up, didn't they?
Absolutely.
You said once
They
it's
called them witches and put them away, didn't they?
Oh dear. Well, definitely now with all the things we're trying to do, mindfulness and everything, I'm sure they'd think we were witches. So, but that's natural things, and it's, you know, I mean, if someone wanted to start incorporating mindfulness for themselves today and hadn't done it before, is there a simple practice that you could suggest that they begin with, maybe?
I mean, I certainly would suggest doing a simple little meditation every day to practice, you know, sort of your breathing and then grounding yourself, because that, you know, the focus on your breath work is massively grounding, puts you in that here and now, doesn't it? So I definitely would suggest just doing the simple, you know, and if anybody, you know, most of the people that will tune in has been to any of your classes, and you start off with that simple breathing exercise that we do, where we close our eyes and we just focus on our breath and breathing in through your nose and out through your mouth. And that's what we learn in mindfulness all the time, repetitive, and then we, you know, move it out into longer meditations like the body scan and things like that. But in realistic, what, you know, time, most people don't have those time to do that. So just the little breath works are just amazing. Just sit in, when you have your coffee, just think to yourself, oh, I'm just going to think about my breath, you know, for a minute or two, and then that will just stretch out into your mindfulness techniques. So learning, you know, to kind of let go, I suppose, and accept, and sort of certain values. But they're a lot harder and more in depth, so you probably would have to follow. But there's some great books out there, and there's a book called A Peace in the Frantic World, and that's a mindfulness course in a book, and it's so easy to read. That's an American version. There is an English version. I can't remember. If I find it, I'll let you know. But they are a really good book, because it teaches you, you can just read and dip in, and it teaches you about mindfulness. So that would be one thing that I would recommend, is getting a decent mindfulness course book. Or Wellbeing Suffolk, they have a little mindfulness course on there. If you go on their online courses, they have a 4-week course that you can just go on, and it's all recorded, and you can just watch it. And that's a really good course to do. And I think Wellbeing have lots of little workshops about menopause or anxiety, and they do a relaxation workshop as well. It's worth tuning in. I think because they're sort of mental health services, we think, oh gosh, but actually that's why they call themselves Wellbeing. It's about everything to do with our mental health. So it's worth tuning into those. But yeah, if I suggest any mindfulness practice, I would just do the breathing work, and then build yourself up into things like body scans and whatever.
Yeah, like you say, it's very simple to do the breath work if that's something where you're starting. And it doesn't have to be complicated. There's different sort of breath work techniques, but sometimes it's just very simply just becoming aware of the breath can be enough, and just breathing in, breathing out sensations, um, without sort of complicating counting, because it's very different for everybody. I don't know, I know that you run mindfulness courses, and you probably do different breathing techniques within there, because obviously different breathing techniques are different for different people. Because I used to do a meditation course, and I found that some people really enjoy counting the breath and they need that focus, or their mind wanders. Other people find counting the breath quite difficult, especially if you've got to count in and then hold and then out. That actually can make them quite anxious as well. So there's so many different techniques, and I think, like you say, if you can get a book or get yourself on a course, you can kind of play around with what works for you then, I think.
Yeah, absolutely. And I mean, when I do the teaching, and when I was taught, we didn't do a lot of techniques. It was just about being aware of your breath more than anything. Because I think you're right, if you get if you go into counting, or I got breathed through one nostril and out my mouth, or it's just like you end up getting so stressed, you think, oh my God, this is just like really stressful more than it is. We just used to, you know, my thing is just to close your eyes and just be aware of your breath and not trying to change your breath in any way. Do you know what I mean? It's just a sort of being aware of it, really. Because it's often, that's just grounding you, isn't it? With just realizing that you're just breathing in and breathing out, and how precious, and it's doing it all on its own without us even thinking about it.
Well, this is it, and it's only when you start to really think about it, it can become a bit too much with the counting.
I know. Well, you can get quite stressed, can't you? And then you're aware of your heartbeat, and then you start to think, gosh, that doesn't sound normal. What's going on there? And then when you're trying to sort of, oh God, no. So I think, yeah, just sitting and just being aware of it, and seeing, you know, I don't know, your thoughts going away in clouds, and you know, there's lots of different little techniques you can do just to breathe in and then breathe out.
I mean, what advice would you have to someone who's a bit skeptical about mindfulness as a tool for menopause? What would your advice sort of be there?
I know, and I think people feel I mean, it does take a lot of work. It's like anything with practice. If you went to the gym for the first time, you wouldn't be able to, you know, to do 5 miles, you know, 5 miles on the treadmill at expert level immediately. You would build up, and it's the same with any technique that you learn. You just have to be patient with it and learn the techniques around it, and believe in it, really, because I think a lot of people think, well, how can just believing in values and meditating, how can it change and relax you and make you feel better? And it just does. It really does. I mean, I've had people come on my courses, and it's just been life changing for some of them. It really has. It's got them through really, really tough times, and they've come out of it, and it just enables them, it gives you the tools to be able to just help, you know, deal with life, I suppose, in a different way. It makes you think about things in such a different way, and how to be, but it is very much on improving your self-worth, and improving on giving yourself a break, really. I think we just don't do that enough. We're so highly critical of ourselves, and we're very impatient with ourselves, aren't we? That we, you know, it just improves that, it really does. So it's worth pursuing, and it's worth looking up and seeing if you can, you know, do a little course or.
Well, I just think as women we have so much pressure on ourselves, like you say, you know, I know we keep going over it with everything that we've got going on with the work and the kids and the parents and everything else. But that is a lot of pressure. And then when you're going through symptoms as well, and trying to balance hormones, and like you say, trying to accept that we're going through this change in itself is quite a big thing. So, you know, having that time out, and you know, even if it is your mindfulness practice is just 5 minutes of breath work every day, that 5 minutes is going to have a massive impact on your mental and physical health. You know, so the more you do, the better. The more you practice, and the more you start to fit these things into your day. Like you say, it could be having that cup of coffee in the morning and just standing outside and think, right, I'm just going to spend 5 minutes just breathing, being aware, and just bringing myself back. So we're so untuned to nature, aren't we? That it's
We are.
kind of, you know, I mean, it's silly things. Like, I mean, some people like myself, when it's a full moon, I don't sleep properly, and it's kind of like it's a bit scary. I think they reckon that there's more babies born on a full moon. So there is, you know, we've still got some of those things there, but we have lost that. We're always rushing here and there, even to yoga. And it's quite funny, you know, you come into yoga, you're supposed to be coming there to relax and have that time. But people come running in because
I
they're
know.
like, oh, work, I've had to do people's dinner before they've got there. And that is our lives now. So it's so important to bring that mindfulness in. And if you're not incorporating that alongside the medicines, alongside any, you know, diet that you're putting in, you're not going to be able to control those cortisol levels.
No,
So,
definitely not. And you're also just going to keep adding pressure and pressure till you break, really, don't you? I mean, stress. This is a massive. The course I did is a stress reduction course, and it's because people just they just continually go and take on more and more and more until it just something goes wrong, and we're not very good at just sitting back and looking. We do quite a lot of work on in one of the weeks of how we can reduce our stress and look at our lifestyle, and it's a bit, just taking stuff away or accepting stuff is going to be stressful and just accepting that, and then that's dealt with rather than overthinking about it. We do a lot of overthinking, don't we, about things, and that can cause quite a lot of extra stress that we just don't need.
Especially, I think, if you're not sleeping for whatever reason, that, it's hormonal, whether you've got things going on in your life, it's at night you're going to sit there thinking about these things as well. And there's those little mindfulness things like the breath work that can just calm you down, so you can get yourself back to sleep. It's just, you can pop sleeping tablets all you like, but you can't be taking them for the rest of your life. It's kind of, you
No,
need those things,
absolutely.
because it's not just going through that perimenopause and the early stages of menopause. We want to get these things in place really for the rest of our lives now, because it's important to, you're going past that, childbearing and looking after, other people. It's that kind of phase where we've got to start looking after ourselves.
Yeah. And doing things that you maybe always wanted to do, or starting up hobbies, and just thinking about those things as well, isn't it? Instead of feeling like we're going through all the motions, how can we tweak our lifestyles? What can we do? Is there something that we've always wanted to do? Why don't we try it? And that's a value that we have in mindfulness called beginner's mind, where you do something that, because it's like being a child, isn't it? A child, they're just, everything's exciting because it's beginners for them. Everything's new. And when we get to an adult, things can seem quite mundane or boring, or here we go again. And that can be quite hard if you have a job or a task that you have to do over and over again. It's going to be natural that it can sort of be quite hard. So just changing it a little bit or tweaking it so that it can bring a little bit of excitement into us, or break your routine to do something in the day. The things like going for a walk in your break time, just to get out and do something different.
Yeah. Well, we forget about ourselves because we're the caregivers. Guys don't really give up their hobbies, do they, when they have children? Women obviously step back because that's, you're then looking after children. And then when you go back to work, you're trying to find the balance between everything, that you forget about yourself quite often. Whereas guys don't do that because they're coming from work, their tea's ready, house is clean, the kids are sorted out. They kind of still have their lives to an extent,
Yeah.
don't they? We're getting to this stage where it's like a new spring, so we've got that chance again to do things for ourselves. Otherwise there can be that real kind of, oh, have I wasted my life? I've got to, especially, some women, they're going through menopause and they've never had children, and they've got to that point, and you're really reassessing your life, aren't you? And that can, be quite a lot mentally, I think.
It can feel quite overwhelming, can't it? Or quite depressing sometimes, sort of like saying goodbye to certain things, isn't it? Say, it's quite a big thing, but like you say, whether we've been able to have children or not, that's the end, isn't it?
Yeah.
The end of fertility. It's the end of
Yeah.
that side of it. Can be quite depressing when you feel like, even though it's very nice not having periods, I have to say. Very, very nice. There
Yeah.
is that side of it, isn't it? If you've had very painful, heavy periods, not been having to have them anymore can be very,
I can't
very
wait.
comforting. I know it is. It's wonderful.
It's wonderful. And it is like, again, that's the good part of it, but it is that taking away, it's our womanhood, isn't it? I guess it's quite a big thing to think, well, that's it then.
Yeah,
I have no
that's that
intention
bit
of
done.
having any more. But it's that suddenly you can't, so it's gone. I think that's what it is. That kind of, even if you don't want to have any more, or if you've never had any, that choice, it's taken away. and I think that's a lot to kind of accept. And I think, like you were saying earlier, women didn't really live very long past menopause. So that was kind of our job was done. And, you know, that, and I think in your head, you're like, well, that's it now.
It
We've
is.
done our bit, so now we're old. But actually, we're not. Women can live for another sort of 40. If you're lucky, you might even get 50 years on. So,
I
you know,
know.
we're halfway through
There
our
was
life, not at the end.
no, exactly. There was you know, because Chris Hoy, he's had a terrible diagnosis, hasn't he? And he's got terminal cancer. And he was interviewed recently, and somebody said to him, "Oh, you know, how do you feel?" Or, you know, it's quite sad and all that type of thing. And he says, "Do you know what? I can still contribute to this world until the day I die. I am still going to contribute, and my my vision will be, what can I do to contribute to this world?" And I just thought, what an amazing way to think. And that's what mindfulness is about. What can we do today that we're going to be able to contribute? How can we live our life and enjoy it? Because we never know what's going to happen tomorrow, isn't it? So, you know, we are worth something. And, you know, we've got all that experience. We've brought up children. We're looking after, you know, we've looked after a family, brought them into the world, brought them up. That's quite an achievement. So we need to celebrate now that we've done that, and what can we do next? What can we contribute?
Yeah, exactly.
What experience can we bring to the world
Exactly.
in a sassy way?
Yeah. I think a lot of women before, because women used to have children so young, by the time they got to the menopause, I suppose they had, in a way, started to get their lives back a little bit, maybe. Whereas I think now women are waiting till they're in their 30s before they have children. So you're kind of like still doing that bit, and the menopause is happening. So sometimes it can be a little bit hard to kind of think, well, how on earth am I going to find time for myself when I've still got children? I'm not in that kind of, my kids have grown up yet. I've still got children and quite often parents to worry about. So, you know, trying to find time for yourself can be really, really difficult. So it's no wonder women are stressed. So those, you know, those mindfulness tricks are kind of really important to be able to fit into your day, aren't they?
They are. They are. It's just, yeah, absolutely. Just keep thinking of bringing your mind back to what, you know, what you're doing and what we're doing now. It's
Mm,
just so important. Because we can't change the past, and we certainly can't predict what's going to happen, can we?
no,
Or
exactly.
control what's happening.
Mm. Have you got any last tips that you suggest where mindfulness or even sort of medically combining the two? Is there any tips that you'd have?
I just think we just need to focus more on enjoying our lives. I know it's really hard when you go through really hard times to sometimes feel positive, but it's just that we only get one life, and I just think we just have to keep trying to focus on what we're doing to enjoy it, and we're the only people in our lives that can actually make us happy. Nobody else can make us happy, and it, you know, it's just finding ways to change and do things that will maybe boost ourselves. I think that's what I've learned, and I've learned that through sort of my job, I suppose, and I care for the elderly, and so I see a lot of people at the end, and it's made me really quite thoughtful over the last year about how, you know, it's life's so fragile, and within the blink of an eye we're there. And so I'm really focusing on my health, and not trying not to be overly obsessed with it, but at the same point taking control of how I feel and what I can do and how I can improve myself. And I think if you've got a healthy body and you eat healthily, and you know, you do all those types of things, it can help to make you feel better generally. And also focusing on exercise and doing hobbies and stuff really brings the mindfulness now, because it just helps you focus on the day to day.
Yeah.
So I'm joining loads of clubs that I never would have joined before, just to give me, so I think that's my one tip to people, is just go out there and go for it.
Oh, yeah, definitely. I'm just going to ask if anybody's got any questions. Can you see the chat? I don't know if that
I
comes up for you as well.
can.
But if any of you have got any questions for Mel, whether that's anything to do with their nurse experience, or particularly anything to do with mindfulness. If you've got anything you'd like to ask, this is where the screen kind of freezes. Anybody's, I mean, you're more than welcome to pop things in the chat after the video is posted as well, and then obviously Mel's in the group, so she can have a little look and answer you. She's quite active within the group anyway, so I'm sure she'll answer all your questions. Have you got any mindfulness courses coming up? Have you got anything planned? Or
I haven't got any set yet, but I probably will do some at some stage. It's always difficult. The COVID's kind of really scuppered me in a way. And it's taken my mojo a little bit away from it, if you know what I mean, as well. It's quite hard, as you know, it's hard work, isn't it, starting courses and running them, and it's but yeah, if I get enough interest, if there's people out there that would like to do one, you kind of have to have, you know, 5 or 6 people in a course for it to be worthwhile. But I'm easy to start them up if people do want to do it.
Yeah, if any of you ladies are interested, by all means contact Mel or pop something in the chat here, and we can see what we can do. But me and Mel are hoping we're going to do a workshop together, aren't we? So
Yeah.
we've not pinned down a date yet, but we're going to try and do something with mindfulness and menopause to try and help ladies as well. So we will let you know as soon as we've got that planned. But again, it's, you know, like workshops and courses, it's the planning that goes into it, isn't it? So, but if we've got people interested, we'll be popping some things on for you to be able to take part in. So looking forward to that. Okay, and I don't think we've got any questions, so but we'll keep an eye on the video once it's ready, because that'll take a few minutes to load down afterwards. So, but thank you, Mel. I appreciate your time. So yeah, and I shall. I think you're in tomorrow for yoga, aren't you?
I am indeed.
In for an evening class, so
I am.
See you tomorrow.
Yes, thank you, Sarah. Thanks for your time as well.
Thank you so much. I appreciate your time. Thanks, Mel. Take care.
Okay, bye. Bye.